Hello and welcome back to an episode of the Bring Curiosity podcast. Today we're with Dr. Maria Teresa Rutigliano, that is a neuropediatrist, right?
Neurodevelopment and behavioral pediatric. I guess it's really, I'm a doctor. I'm an intern. I'm doing this specialty, yeah.
You're specializing in pediatrics and in particular in neurology, right? In developmental.
Yeah, and also psychiatry. It's really strange. It's like a subsubject of pediatrics. It's very specific. It's the only one that study neurodiversity.
That's amazing. So you work specifically with neurodiverse children.
Yeah, and also I am a neurologist, so I do psychiatry, neurology, and neurodiversity.
That is really, really cool. And you're ADHD yourself.
Yeah.
Did you survive until here with your ADHD?
Well, I am self-diagnosed, and I discovered I was ADHD and autistic through your TikToks, honestly, and other creators. But yeah, it was really hard, really, really hard. I was 25 years old, and it was 2020 when the pandemic struck, and I was on TikTok constantly, and I found out about neurodiversity, and it was like a rabbit hole. Of course, it became my special interest, and then I thought, you know what, whatever, I will do that for the rest of my life. If I can help children or teenagers with ADHD or autism, I will do that.
That's amazing.
So yeah.
So you faced a lot of struggles up until this point, I'm guessing.
Yeah, I have PTSD too.
Yay, amazing, like a lot of us.
Yeah.
So I guess, this opens to my first question, which is, what are the risks for children with ADHD or for neurodiverse children that are not diagnosed or not treated appropriately?
The main risk, I think, is being misunderstood, because you don't understand yourself. You know something is wrong, but you don't know what it is. And your parents don't understand yourself and don't know how to help you, your teachers, your peers, and sometimes even your doctors. So you're feeling alone and misunderstood. And all of my patients always told me, I guess I'm sad, because they have alexithymia. It's so frequent, you cannot tell. So they think they are there and look at you and they go like, oh, I guess I'm feeling sad because I'm lonely. And I'm like, oh my God, I'm so sorry you're feeling that. I would like to hug every one of my patients, but I can't, of course. And I also don't like to be hugged. I would, but I won't. And yeah, these two lead to emotional dysregulation and substance abuse. The majority of the time, my patients they try drugs just to self-medicate. They feel like this crippling anxiety or depression, and they try drugs. 9 children out, teenagers for the majority of the time is teenagers. They try drugs just because they want to feel less anxiety, basically.
Yeah,
but
because they want to feel less depressed.
Yeah, depressed or less, don't feel the anxiety, or just, sometimes, they do to try it because, you're a teenager, everyone is doing it. So you do that, like, you don't want to feel an outsider. Yeah. But for the majority of time, they are trying to self-medicate. And the main risk is that they're drugs and you're not using them correctly. So they will lead to other problems, of course.
Yeah.
And another main risk is self-harm. I cannot tell you, every day I have, like, in the ER, teenager, children that have tried to self-harm themselves or to commit suicide, and that's heartbreaking. because you're just a child. Why are you doing that? I feel so bad that you're doing that. But then I think, well, when I had your age, I tried too. I did self-harm myself. I did try to commit suicide a couple of times. So it's like, I'm you, you are me, and I'm here for you. I can help you. So it's, I'm just trying to help. That's that's the thing. But yeah, that's the
And so
main risks.
when they get diagnosed, they finally understand what's going on. Does that help them in any way? Just the knowing, not even the therapy or the treating part, but does just knowing what happens help them?
So it's a very tricky part, the diagnosis, when you have to tell them, not for them in particular, but for the parents. I found out you can be sued for telling a parent your child is autistic, your child has ADHD. So you have to be very careful of your words, and you have to be very, very mindful of how to explain the parents what that means, what are the needs of their child. That's it's very tricky. I mean, I have the power to speak for their child, but I have the power also to make them accept the diagnosis. So, because it's not so common. Most of the time, they don't want to hear about autism or ADHD. They come into the room and they told me, "Oh, I heard about autism," and they eyes full of tears, and I'm like, "Oh yeah, it's okay. It's just neurodevelopmental, a different way of the neurosystem to work. It's not something to be worried about. It's not a pathology, but they don't want their child to be autistic or ADHD. They are scared because they don't know about it. The only thing they know is stereotypes or bias. They are biased in the idea of autism, especially autism.
I think the scariest part in that is that when a parent refuses kind of the diagnosis, it's not going to make the neurotype go away. It's just
exactly.
you're hiding from what is happening anyway. I mean, the fact that a doctor tells you it's autism or doesn't, it will not change anything to your child.
Exactly. It's only worse if you don't accept the diagnosis. But you have to be careful. My superiors have gone through very many lawsuits about
Madonna. This is horrible. Why can you be sued? This is crazy. Just for it's like it's a medical diagnosis.
It is, and they just don't want it. It's hard to explain. I don't know how. It was like very strange for me to understand. But my superior were like, "You don't have to tell that. I do, because it's very tricky. We can be sued. So just be careful." And sometimes parents told me, "Oh, I don't want my kid to be autistic," and I'm in my mind because I cannot tell that. I'm like, "Well, you tell me." I'm autistic. I have ADHD. What the fuck are you talking about? You're talking to a disabled person, but I'm a doctor. So if I can do it, I made it. Your kid too. Maybe it will be something completely different. It will be okay too. I mean, they're amazing. My patients are all amazing human beings.
They get better, right? I mean, once they understand themselves, the children, what is going on, do they feel less alone somehow? Or less sad?
Yeah, the thing that I've seen is that they understand themselves better, and they know how to advocate for themselves, and they recognize better which one are real friends from fake friends. And I think that's the main difference. Yeah.
That's amazing. So basically, just by knowing that they have a different neurotype, they learn self-advocacy. That is super important later in life.
Yeah, because they told me I don't know, like examples, especially when they are in classroom, they told exactly what they need to their teachers or to their peers. So it's in some way it's advocating for themselves. If they don't feel comfortable with something, they can do and say that I'm autistic, I don't want to do this because of this and this. So it's great. And you see that they grew self-esteem, which they don't have at the
Yeah.
beginning, because they feel
Yeah,
awful
yeah,
about
because they think
themselves.
it's their fault somehow. If they cannot do
Yeah,
something, then it's their fault.
yeah.
Yeah, yeah, I felt that a lot when I was younger as well.
I feel that nowadays. No,
And
I'm kidding.
as
I have self-esteem.
I'm glad to hear that, honestly. And when they grow up, they get better. I mean, they have less substance abuse and less of all the risk that you mentioned at the beginning, right?
Yeah. Yeah. If they don't, if they don't grow into some other problems like substance abuse, and they enjoy using drugs, of course, but the majority of the time they just stop using drugs and use the prescriptions, and they feel better and they just stop. Yeah.
Okay, so
I
that leads
hope.
to
Well, at least they told me. They tell me this, but I don't know if
uh,
it's
hopefully it's true, but I think it is,
hopefully
right? I
it's
mean,
true.
studies show generally that when children are medicated or at least treated, even therapy or just diagnosed, they generally grow up to be better than people who are undiagnosed.
They told me that they are afraid to mix prescriptions with drugs or alcohol. So I think it's mainly based on fear of dying, basically.
It's fine. I mean, if it leads to less problems, then it's not necessarily a bad thing, to be honest.
Yeah, I think. Yeah, in fact, I think so. It's okay, but I do see them, and I see that they are better. So I believe them,
Great.
basically.
So this leads to my next question: how do you treat children that have ADHD or autism?
Yeah, so it's pretty the same as you treat in ADHD in adults. You have the psychological therapy and the pharmacological therapy. The only difference is the dosage of the prescription, because if a child is petite, um, an adult it's bigger, so it's the dosage. But we use amphetamines, and we, as a pharmacological therapy, I'm talking about, of course, but it's a very risky, it's tricky there too. You have to do a lot of examination. You have to do EKG. I have to weight you, and I have to do blood samples. And we do like a stress test. We do a stress test with Ritalin, which it
Mm-hmm.
was a drug used in USA. They are not allowed to use it anymore, but in Italy we use it just to do the stress test, because it's amphetamines. They have like a very small range in effects, like a few hours. It works
Mm-hmm.
for a few hours. So you are here in the hospital with me and my colleagues, and we are monitoring you and the way you feel after we give you the drug.
Okay.
And so we have to control your blood pressure, because you can have hypertension.
Yep.
And we have to check your heart rate and the way you're breathing and the way you feel, basically, because if it doesn't work to everyone. So if
Yeah.
it doesn't work, we are not going to give you
Yeah.
amphetamines
No.
just for
Of course.
fun.
A lot of children say that they don't feel the same when they take medication, or that they don't like the
Yeah,
effects. So it's something that they should know when they're in a doctor's office, right? This is super important. This step. I didn't know that
yeah,
you did this. It's great.
yeah. It's really complicated. It's a really complicated process, and you have to see the child or the teenager every 6 months. or maybe 3 months if we see something strange in the EKG, because amphetamines can prolongate the QTC, which is the interval of your ventricular when your left ventricular contracts and then relax, because amphetamines can prolongate this time, and if it's too long, you will die basically.
Yeah.
So
it's very
you have to
important
be very
control.
careful.
Of course.
Yeah, I've lost a child, a teenager, because of this problem.
Do you also use non-stimulant medication then?
Yeah. Basically, it's for anxiety. We use like pregabalin or oh god, how to say that in English? It's antidepressant, basically.
Yeah, SSRIs and
that's the one. Yeah, but we use mainly for ADHD. We use amphetamines.
All right.
Or
and methylphenidate.
Pharmacological, yeah. It's like we have two drugs that we use, Medikinet and Esquizine. They have a different range of effect.
Yeah.
Like 4 to 6 hours, the first one, and the second one is like 6 to 8 hours. So we told the patient to take the medicine before they go to school, so they can just be focused during school time. Then they don't have to take it. But these prescription, they are drugs basically. So if I give you the same drugs for a long period of time, you will not, it won't work anymore the same way it does at the beginning. So what we do is in summertime, when you don't have to go to school, we took you off prescription. You do like a pause, and then in September we begin again.
And
if you need it.
Works. Do children react well to this? They're happy to have a medication holiday. How do the parents react? How does this work usually?
Well, okay, so it's different from person to person, of course, and some patients are very compliant to the therapy, but some others don't want to take it. So it's really complicated. Some parents don't want to use it. They told me that their child looks different. It's less funny. It's less happy. It seems more serious. It's just that it's focused, basically.
Yeah, this is a lot of feedback that I heard as well. So this is, one of the questions that I had is should you give medication to children? Basically, does that really help, or does that make them different? Does that have too many side effects, too many risks of some kind?
We very carefully choose which patients to give the medication to. Basically, it's like most of the time it's for the hyperactive ADHD type. We don't give it to inattentive because it's not really necessary.
Really?
But for it is. Oh, I'm sorry, my phone. It is. I think it does work, but in my hospital we don't do that because my professors doesn't want to. They treat mainly kids with hyperactive type of ADHD. That's one of the bias I found in my practice.
Yeah, so
they think ADHD is basically the hyperactive type. It's mostly in male, and it's the hyperactive type.
Yeah, so they're still quite behind on everything.
Yeah. They know it exists, the fact that we have like a lot of types of ADHD. They are conscious about that, but they treat mainly males with hyperactive type.
Yeah, so there's still a huge bias in medical practice.
Yeah, I cannot tell you how many times I was with a female patient and I thought, you're for sure autistic. But the
Yeah.
test we run, they turn out to be negative, so I cannot put the diagnosis. And I have to let her go and don't say anything, and it's the worst. It's just the worst.
And for ADHD as well.
Yeah, because we can diagnose a patient for ADHD just with a test. It's the SNAP test, and you have to do it with the patient and the parents. And there are like 27 questions. It's really a quick test. It doesn't, I mean, how can you tell if a person has ADHD by just 27 questions? It's very, I mean, it's too later. I don't know. It's not enough. I mean,
you have the same for adults as well, or this is just for children?
This is for children and teenagers. In adults, you use the DIVA-5 test. They did it to me, and they basically told me, you have all the characteristics of ADHD, but you didn't have them when you were a child, so we cannot tell you have ADHD, which is crazy because my brain has always worked the same way. So
Yeah.
The only difference is that when I was a child, my mom will help me do all the things. So I didn't
There
have
you go.
to think about that. I wasn't, I was helped. But my mom always told me, you didn't do the homework unless I was in the room. Sometimes I thought you were a jerk because you didn't do what I told you to, because you forgot. You always tell me you forgot, but it wasn't true. It was just you didn't try enough, or you were lazy. And I was like, no, I was ADHD all the time.
So now you have your official diagnosis?
I'm still self-diagnosed, but they did find I have a learning disability in mathematics. So I did med school and all that with a learning disability without any help.
Fuck. Yeah, so
I just managed
they are so behind, yeah.
to survive.
Yeah, they're still so behind. This is appalling because there's so many people who are ADHD, who know about it, who have done tons of research on it, and who still cannot get a diagnosis because of medical biases like these ones. I've had to complete, I think it was a 4-hour questionnaire during my diagnosis. It was crazy.
Yeah, me too. It was so long, and I was feeling exhausted after it. It triggered
so
me
long.
like a meltdown. Yeah.
It's
and
so not ADHD friendly.
Yeah, for sure. And sometimes they do ask the same question after like a small period of time, and you're like, you already asked me that. Why are you doing that again?
Yeah.
But they have to.
Yeah, but it's horrible. I mean, and every question can be answered with "it depends," and then you have the thing with, did you have it as a child? And they bring in the parents as if it was some sort of police questionnaire. I mean, I'm getting a medical diagnosis. I need help, for fuck's sake, right?
Yeah,
it's crazy. And so this
crazy.
is, a question that just comes to mind. But what do you do with the patients that end up, coming to the clinic, coming to the hospital because they need help, and they, that they have autism or ADHD, but the test says otherwise, because it's still very biased. So what do you do with these patients? Do you just send them home without anything else, or you're like, okay, we're, going to look more into it? What happens to these people? Because I think this has been my experience as a patient a lot, and one of many people that I know that have ADHD, that they just came and they were like, oh, you have nothing, you just have to go home and be happy and bye.
All right, so I experienced that too, as I told you, and in my personal experience, I was whatever. I know what I am. I know my answers. I know I went to medical school because I was searching for my answer, and I find them, and I just know whatever. And TikTok and creators like yourself help me not being just believing in myself, basically. What I do, I cannot for now, I mean, because I'm an intern, but when I will be a medical, a neurodevelop and behavioral pediatric, I will put the diagnosis, and I will, every time I just feel that kid or that teenager or adult, for what it counts, it's neurodivergent, I will put the diagnosis. And right now I'm trying to fight the system from the inside. So what I do is like, basically I take notes about my patients, and when they told me I am struggling with, I don't know, for example, sensory issues, maybe the sounds or something like that, I just take a note and write down, just try these headphones, try this or that, and I give these notes to them and give them my cell phone and tell them, if you need anything, you can call me. Right now I'm just fighting the system from the inside, but in the future I hope just to change this, because it's very biased, especially for females.
Yeah, that's horrible. And
Yeah.
does that help them? You know, all the little tips that you give them, does that help them? Has any of your patient told you, hey, you know, this thing that you gave me, it's really cool?
Yeah, it has happened, and it made my heart so full of joy. I cannot tell you, I just became emotional about it. It's just, you see that they look at you like you saved their life basically, and you're just, I'm happy. I'm sorry, I'm happy. It's just,
Yeah, I mean, you know, maybe you did save their lives just by giving a stupid advice or making them feel listened to. It's
yeah,
small, but maybe you did save their lives, because
yeah, I'm
sometimes that's
trying
all it
so hard.
takes.
Yeah,
I
I'm
think
trying
you're
so
doing
hard,
great.
because in my, no, it's fine. In my job, I have like a social a role, because I do work with juvenile court, and I do have patients that have suffer from abuse, physical, psychological, and also sexual abuse. So it's, and they have ADHD or autism too. So I'm
Of course.
there for them basically. And so yeah, when you can do like little small things, it's huge for them and for me too. So
Yeah,
yeah.
I mean, you know, the medical system can be very violent with patients. It can be very cold.
Yeah.
And sometimes just feeling like someone is listening to you and understanding you can make an enormous difference on whether these people are going to choose to return to the doctor afterwards, or if they're just going to stay home and, you know, be scared of taking an appointment to the next doctor because they have been mistreated before. So what you're doing is making an immense difference. So this, you know, I just cannot
I
thank you
hope
enough for
so.
that.
I hope so. Sometimes for them it's just amazing if they can talk about their special interest for like 15 minutes, and you're there just listening to them. For them it's huge.
It's support.
And for me it's so fun. I
Yeah, it
mean,
is.
I've discovered so many things.
And
Yeah.
so about, you know, about the support that you give them, what kind of support system can exist for neurodivergent children at school, at home? What kind of things can
Yeah.
parents or teachers do basically to make their children's life easier in that sense?
I feel that for children it's better. The support system for children is better than for adults.
Mm-hmm.
I think right now they come to the clinic and we diagnose them, and we have to write, basically it's like an essay about the patient, and we do need to be very specific about what are the needs of the child,
Mm-hmm.
so that they can have access to accommodation, tools. And basically in Italy we have different laws that protect disabled people rights, and they children have a support. How do you say in English? It's called like they are in class and they have the teacher, but they also have an assistant just for themselves. It's just like a
Okay, they
special
have a
needs
tutor.
teacher. Yeah, they have a tutor in school and also at home. They are two different tutors. So they at school they can learn with this tutor, and they have maybe they can have like a different program for some subjects in school, and at home they have this educator, I think it's called, and they help with homework or to do chores or to everything they need basically. And they also we encourage them to do cognitive behavioral therapy, because it's the best for ADHD and autism child. And then
for
I
learning
did
tools and
for
habits and
learning
stuff, right?
tools. Yeah, also just to emotional regulation and to fight alexithymia, because I think it's very important for them to understand what they are feeling, because they don't know. If you ask them, they don't know. I have to like draw a little thermometer, and I say to them, all right, this is the happy thermometer, just help me understand where are you. Are you at 0, at 5, at 10? And you have to explain to them, and they are like, oh, this is helpful. I have a visual way of understanding my feelings, because they don't know basically. And I do understand that, because I do feel I do have alexithymia myself. I'm just learning and learning and learning with them, so it's fun.
So I'm going to go on a slight tangent here, but a lot of adults that have ADHD or autism said that, CBT feels kind of like gaslighting your emotions. So CBT for children and for adults can work in different ways, or can be perceived in different ways by patients, right?
I think when you're an adult, yeah, it's tricky. I mean, children don't know, so I've saw that it does help, but it's like they are learning to mask better. I think it's like that.
Yeah, but
it's helpful in a way, but it's also I don't know.
What about masking? Because
God.
recent papers on masking has shown that it increases stress, it increases anxiety, it increases just exhaustion overall, because it's just an effort doing that every day and all the time. So if you teach them to mask in a way, aren't we just delaying maybe the burnout? Or
yeah, basically yes.
It's an open question, right?
It's really it's hard, I think in certain situations it is important to know how to mask, but you have to be conscious about the fact that you are masking, and that later on that day you're gonna need to rest. You need to be mindful about masking. Right? So it's like it needs to be a tool that you use and you're conscious of doing it.
Yeah, so
otherwise
basically
you're gonna be
with CBT, what you're teaching children is to have that mindful masking instead of just doing it automatically, not realizing you're doing it, and then being exhausted when you're 16.
Yeah, I think so. Maybe I don't know. I think they told me, my professors told me it's better for them, but I didn't do that. I did neurofeedback, and that was really helpful. I don't know if you know about this. It's very new, a new kind of
I know
therapy.
about it. I've seen very mixed results about this with placebo-controlled trials. They didn't seem to have anything super significant on some of them. On others, then it seemed to be working. So I'm still not sure what I think about it, to be honest.
In my personal experience, it did help me a lot, but I don't know if it has like a long-term, if it's useful in long-term periods of time. I think it really works in I don't know how to say in English, but when you
In
do
short
it,
term,
it's
yeah.
really working. Yeah, in short term, it's amazing for me, at least. But on long periods of times, I don't know.
Well,
I will tell you.
there was one paper that I saw that they had a 13-month follow-up, and the neurofeedback group, as opposed to the placebo one, did have a change that was consolidated in the 13-month follow-up. So that seems to be promising,
Yeah,
at least.
yeah. That's what that is what my therapist told me. I
Yeah,
did it
that's
for it was like 1 year ago, and then I just stopped in June because I graduated in med school, so I just stopped. But it did help me a lot.
that's amazing. So these are some tools that children with ADHD and autism can learn. But what about tools that teachers and parents can learn?
Oh, I mean, first of all, just listen. Listen to your child.
Yes.
Listen to your teenager, and have an open mind about that. Be curious, be kind, try and be inclusive. And also, I think the most important thing is to use like the Pomodoro technique. I don't know how to say in English. Tomato technique?
Yeah, yeah. I think they call it Pomodoro technique as well.
Pomodoro, right? Yeah. That helped me a lot. Creating like a very calm and inclusive space. And just if the child needs to steam, just let them do that. Whatever. I'm steaming right now. I'm always steaming. It's fine.
Yeah, me too.
And yeah. I use a lot of double body as a tool.
Yeah,
And
body
I use
dubbing is
music.
great. Oh, music.
Yeah, body dubbing
Music is
is
amazing.
music.
There's been
Music
so
saved
many
my life.
papers. Yeah, same.
Yeah.
And there's been so many papers showing that it just helps. It helps with your emotions. I mean, sometimes I cannot describe the emotion I'm feeling, but I can make you listen to a song that matches that
Yeah.
emotion.
Yeah, exactly. That's so crazy. It's so powerful. And I can self-regulate my emotions with music. I usually listen to lo-fi or brown noises when I have to study and when I have to be focused, basically. And sometimes I even using that when I have to write the the patient's paper. And so if you just pass through the corridor, you will listen to my music, and I'm so focused. Yeah, it's so helpful.
Yeah, I've written
So
my whole
I
thesis
think
with heavy metal.
sometimes I do that too. I mean,
Yeah.
sometimes it's needed, definitely.
And so following up, how did your ADHD, how did your experience influence the way that you practice medicine?
With ADHD, you mean?
Yeah.
Oh well.
What are
I
challenges that you find that are specific to your ADHD, or what are advantages maybe, because maybe you understand the patients just better than other doctors just because you
Yeah.
live through the same experiences, right? It's so important to have doctors that have your condition as well. But
Yeah.
in general, how did all of that influence, how did your ADHD influence your medical practice?
Well, I'll tell you something. I'm working at the clinic from it's like since the 1st of November, and I've lost my lunchbox like 13 times. I've lost everything. Patient paper.
Oh my
I've
God.
lost. Yeah, it's bad. And every time I feel, even though it's not my fault, I feel guilty.
Yeah, of
And
course.
sometimes I did do something good, but somehow the paper just disappeared, and I think, oh my God, what have I done? And I didn't even touch that paper, but I think it's my fault.
Yeah.
Every time. And the main risk with ADHD, at least for me, it's when they told me like the dosage of a drug, and I have auditory processing disorder, and sometimes I didn't hear that, so I'm like, can you say that again, and wrote it down because I'm not sure, and it's drugs. I don't want to be
Yeah. No, it's super
a
important.
toxic amount of that of
Yeah.
drugs. Yeah, so it's challenging. I'm not telling you it's all right. No, it's not. I'm very scared of doing something very, very stupid because of my ADHD. But at the same time, I know I have like a superpower, because my colleagues told me, you notice things we don't.
Yeah.
When you're listening to a patient, you notice things, and you're very, very mindful. So you have to balance and
It's a
don't
trade-off.
be burnout.
Yeah, I think that's the hardest part, because you try so much of being at the same level of everyone that it becomes very hard not just burning out and doing too much just to prove that you can. Um, but yeah,
Yeah,
at the same time,
you can do it,
yeah,
basically. You want to demonstrate you can do it,
exactly.
even though you are neurodivergent.
But is, as you
And
said,
sometimes my colleagues told me, I don't want to listen to you because you will forget something because you have ADHD. So, and I'm like,
oh,
this is ableist.
yeah, so
This is
you're,
rude. Oh, sorry. I have like a lot of alarms because I forget to do everything.
that's fine. So your colleagues haven't
Um,
been very understanding of that, even though they work at a psychiatric clinic.
they some of them are very curious and ask me a lot of questions and told me, I want to learn from you because you're part of the community and you know so much. So I want to learn from you or from other creators that I linked to them. I linked some of your TikToks too,
Yeah.
and so they are very understanding. Some others, I think they shouldn't do this job. I think they don't have the the open mind to do that, or
Or
they
just
are
the
very
empathy.
biased. Yeah, or just the empathy, because they did say something very ableist to me, or about other patients, and I was like very hurt about that, but I couldn't say anything because you don't want to argue, or someday I will tell them something, because if they keep going, I will broke. But for
But
now, I'm just trying and
there comes a point
make
where the
them.
emotional dysregulation and the impulsivity takes over and you just explode.
Yeah.
Like, fuck off.
One thing I've learned that I didn't know is that with ADHD, it comes other. There is another comorbidity that is oppositive provocatory disorder,
Yeah, ODD,
and
oppositional defiant disorder.
yeah, and I think I have that because I don't
Yeah.
like authority, I don't like no's, I don't like rules.
Yeah, I mean, there's still
So
a lot of debate on that one. A lot of people don't like this appellation because they're like, oh, challenging authority, it's a good thing. Yeah, but it's more complicated than that, because I think,
yeah, of
yeah,
course.
one of the worst parts, because I very definitely have that as well, right? Every time I hear a rule or anything, I immediately want to do the opposite, and it's very hard
Yeah,
to regulate myself, even though I know that it's something that is good for me. I immediately want to do the opposite. If something is forbidden or I shouldn't do it, then I want to do it. If something is an obligation, then I immediately don't want to do it anymore. It's super, super difficult just balancing that and trying to rationalize the fact that some things that you shouldn't do or that you should do are good for you, because
yeah.
as soon as they become an obligation, it's out the window
You don't want to do it
immediately.
anymore. Yeah.
Exactly.
Okay, I won't do that. I do the exact opposite of what
Just
you're
like
telling me. Yeah.
immediately. And what a lot of people with ADHD don't understand is that you're still, subject to not really manipulation, but you're still not having an independent thought when you do that, because if your first reflex is to rebel automatically against any single rule that you're given, you're not critically thinking about what that rule does. You're just rebelling for the sake of rebelling. So it's not good either. And it's,
Yeah.
just as bad as following blindly every rule without thinking about it.
Yeah, definitely. I think, okay, so the thing with me is, if I understand why are you telling me not to do something, I understand the logic behind it, I won't do that. But if I think that rule is just for the sake of it, I won't follow it.
Yeah,
It's just
same.
stupid. Why should I? Or sometimes
even if I understand the
I
rule
don't
sometimes,
follow.
I still want to break it because it's a rule. I will not do it because I can rationalize it. But if I cannot rationalize it, I'll just break the rules.
Yeah,
It's
sometimes
crazy.
I do break the rule just for the sake of it, just more rules, just because I have like to let me breathe, just to let me do something stupid for once.
Yeah, I understand that very well. Okay. So I would like to come and wrap this all up with a last question. It's, since you work with children, you work with teenagers, so in your
Yeah.
professional and also personal opinion about your own experience and so on, what is some advice that you would give to parents that have to handle an ADHD child?
Be curious, ask questions, be kind, be inclusive, listen, and just don't try and make your child or your teenager as others. He doesn't, he isn't, and it's beautiful the way he is. Just, your child will always tell you what he needs, and you have just to listen. It's just that simple. I think that's the most important thing. A lot of the time, parents ask me why my child is like that, and I'm like, well, it's genetics. I mean, maybe a little bit ADHD yourself, but of course I cannot tell them, but I really like to. But just listen and be inclusive. That's the main thing you have to do. I think it's the most important thing. I do have one patient with two great parents. They are very understanding, and they are so inclusive. They're just amazing. And I told them, you are my favorite parents, and you are doing so great with your child. He's so lucky. You don't even know that. He's great. He's doing great. And I'm so happy for him. He's very lucky. But it's one. And I have a lot of patients. And most of the time parents ask me how to not how to make their child not neurodivergent, and I'm like, I cannot do that. It's impossible.
So
I think
basically,
that's the main thing. I
the
think
first
the
step is
most important
acceptance.
thing is to learn from neurodivergent people, to listen to the community, not listen to, not to read books or something like that, because it doesn't help anyone. It doesn't, because books are written from an outsider perspective, point of view, and you need to hear and listen to the neurodivergent person point of view. That's the main thing.
So the two things that you mentioned that are super important is, first of all, the acceptance that your kid is neurodivergent. Just don't try to change them, because anyway it's not going to happen. So just accept that they are different. And so the second immediate step is just listen to what they need and accommodate that need that is specific to them and that cannot be applied to other children.
Yeah. And I saw so many parents make their child be friends with other neurodivergent children, and that is really helpful too, because they feel like they are not alone. Basically, they have always someone that understands what is going on with them. So I think that is important too.
That's amazing. So yeah, also finding a community of like-minded children, so that can help.
Yeah.
And then therapy for the parents, because yeah, as you said, it's genetic. So
yeah, we do yeah, we do advise. So we do like we write the paper, and we gave them some advice, and we told okay, your child needs to have a tutor, needs to take these prescriptions, needs to do therapy, but we do always advise for parent trainings.
yeah.
And they don't often do that.
But those
it's
who
so
do,
important.
it's helpful for those who do.
Yeah, definitely.
Yeah, that's also what papers show.
Yeah.
Yeah, that parent
I
training
mean,
is more important than therapy for the child, according to papers.
yeah. It's, I mean, it all begins with acceptance, and then, but you have to know how to listen, and how to react maybe to a meltdown, or maybe to a shutdown of your child. You have to learn that, because you won't learn that from books.
No.
They don't tell you how to do it.
No, they don't. They don't. It's a lot of trial and error, and yeah, you have to learn from the person itself that has, because every ADHD and autistic person that I've encountered as well has different needs as well.
Yeah, it's completely different. They every time I visit my patients, it's like you are a word, and this other child is completely different. It's like having, it's amazing. They have their own mind and their own space and times, and it's beautiful. It's just, my patients are my special interest.
That's amazing.
I love to learn about their routines and their special interests, and yeah, it's so fun.
That's great. I think you're going to be an amazing doctor, and I really hope that
I hope so.
clinical
Thank you. I
practice
hope so.
in Italy and everywhere changes and starts to learn not only from patients but also from scientific papers, because from my understanding they're really behind on that as well. And I hope that your generation and this kind of new wave of doctors that are also now neurodivergent is going to bring just more light and more help into the medical world and into the clinical world. This is just really great. And I do really think that you're making a change and that you're helping a lot of children.
I really hope so. I really hope so. This is all I want to do. I did enter surgery school, and I did say no to that, because I thought this is more important. And all my life, I told everybody I want to be a surgeon, but it was so important to do this instead.
I am convinced that you're making a huge difference. I am really convinced of that.
You are doing it too, you know that. Every time my professor asks me something about ADHD or something, I go to your TikToks and search and find articles, and I'm like, Dad, no, I didn't. Ludovico did. Yeah,
it's
so thank you.
part of the goal. Thanks. If people listening want to I don't know, maybe get a diagnosis in your clinic, or join you, or listen to, or find you on social media or whatever, do you want to be found on social media, or do you want your clinic to be found, or where can they find you, basically?
Oh, well, I'm working in a hospital in a very small city. I'm in an island right now. I'm in Sardinia, and I'm very far from my home, which is Rome. And but yeah, I'm in a hospital, like a public hospital right now. And in my social media I'm a red cowboy boots, because of How I Met Your Mother on social media. So
okay, on
if they need
Instagram.
something, they can find me there.
Okay, excellent. It's just, if people are interested to contact you and to ask for more clinical information, or pediatry parenting or whatever, this is where you can find Dr. Maria Teresa.
Yeah, thank
Perfect.
you. Thank you
think
so much.
we have everything. So, thank you everyone for listening. Thank you, Mariateresa, for coming and for explaining everything about clinical practice and about how it is being an ADHD pediatrician. And we hope to see.
Thank you.
And we hope to see everyone on the next episode.
Thank you. Thank you very much. This was